Hi guys, good evening. This is Jasleen from Jasleen Khoz Academy. So today I'm going to take a session on OET speaking. So we are going to discuss about the speaking criteria, what is important in that, how you get your score, B grade or A grade, how it is possible to reach on a score of 350. How do they evaluate? How do the OET examiner, the investigator, they evaluate your speaking? So we are going to discuss on this. All right. So moving with that, I'll just first tell you that this OET is, of course, the full form is Occupational English Test. It is only for the healthcare professionals. It's not for the non-medicals. Okay, and I would like to talk about the some important vision of our academy, that we always try to build a stronger concept to the nurses so that they can be make themselves free and feel confident to clear their exam. And definitely we provide them best in class coaching and try to give them additional special classes so that in case if they are not able to speak or ask something during the group session, they can even um, ask us individually as well. So we are very much committed to our values. So as we are compassionate, and in fact we are quite open to receive your um, concerns about it. Now, I would like to talk about a bit uniqueness of our academy. We all are here licensed and professional. We have been certified by OET, and they all are. TESOL is, a English teaching program. They all are certified by that. All the trainers, and we provide a good material, regular test series like Monday to Friday. There will be a regular sessions, and along with that Saturday will be a mock test. So when we talk about a scoreboard of OET, that how it is, like you might have heard IELTS. I said OET is for the medical and IELTS is for the non-medicals. So when we talk about OET, it has a grade level. So in IELTS you might have heard grade band 8 or band 9, which is equivalent to OET grade A. And similarly, B is the average, which is required, important. The B is must to have, so which is equivalent to 7 or 7.5 in IELTS. Again, C plus. Now some countries like UK, Ireland, they have accepted C plus in writing. In UK, it is C plus in writing is acceptable. That is equivalent to 6.5 band in IELTS. And in Ireland, they accept C plus in any one module. It could be anyone, listening, reading, writing, speaking. However, for UK, it is fixed that C plus should be only acceptable for writing. But yes, in Ireland, it could be in any one. Rest all should be B. So this is the criteria and the difference in the scoring for IELTS and OET. Now, the main topic of our is speaking. Now you should have some a bit clear idea about the OET speaking. Basically, this test run for 15 to 20 minutes. Okay, so here, most important thing, like most of the nurses, they ask this common question that I don't have nursing knowledge now. It's been so long that I studied. But let me just clarify this. This OET is not going to evaluate your clinical knowledge. It is an English language test, and they'll evaluate only your English skills. So your clinical knowledge is not at all be mandatory. Mandatory in the sense they're not going to evaluate you or going to give you score based on your clinical skills. But yes, the communication skills are quite important, and that's how they made a criteria so that it is easy for you guys to understand and follow that. Now, this assessment criteria is basically divided into two. One is linguistic, very much related to the language, English language, and second is the clinical communication. So I'll just take you through a brief of that, not in the deep. We can take a separate session in the deep later on. So when I talk about linguistic criteria, there are 4 points here and each one is measured as six marks, that is six band. So like intelligibility, fluency, appropriateness of language, resources of grammar and expression. So as you can see that these all are related to the language. How do you speak, how's your grammar, your pronunciation, your tone, rhythm, fluency. All this will be judged by when your speaking will be recorded, and the examiner is going to listen to that and see that. So all of this point, even giving a pause, stopping at a particular point where you have to stop, is there's also marks for that. So where you have to give a pause, when you should stop, how much you should give a pause, these all things are very important to know. So we will discuss this in a different session in detail. Now, second point is the clinical communication criteria. So when we talk about clinical communication criteria, very common in medical field, like first of all, it's a bonding between a patient and a nurse. It could be a doctor, it could be anyone, any medical professional. So it should have a bonding with the patient. Now, what is most important thing is relationship building. How do you build a relationship with the patient when you see a patient first time or maybe multiple times? But how do you build that? So remember, you are the one who will always start the conversation. How do you listen to the patient? How much you respond to the patient? Are you getting judgmental for the patient, or you're empathizing? Like somebody says, "Oh, doctor, I'm in a severe pain." Um, you'll say, "Okay, let me just see that." Now, this is not an appropriate way to respond. When a person says that, "Oh, I'm in a severe pain," your actual response should be, as a doctor, as a nurse, or any medical professional, you'd say that, "Oh, I'm so sorry to hear that. I can understand how terrible it be." And then you evaluate. Now, this empathization is very important. Now, when I talk about the relationship building and these points, which you can read on the slides, these all carry three bands, three marks. With three bands is very important, you know. And as examiner, when I listen to your audio, I will judge you based on this checklist. As examiner, I will have this checklist, and on that checklist, I'll see that did you start the conversation, you were attentive, you were judgmental or not, did you show the empathy. So accordingly, I'll give you three band out of this relationship building. So if you follow all this, your 30 marks are confirmed. Now, second is understanding and incorporating the patient's perspective. Now, how do you understand the patient? Are you listening to the patient? Are you giving him, are you able to and take out the concerns of the patient? If patient is say, "Oh, I'm feeling so, my night was quite terrible. I wasn't able to sleep." So as a nurse, it's your responsibility to explore the patient's concern, that why the patient wasn't able to sleep, why the patient don't want to take the medicine, why the patient want to go early home. All these things are very important. As a nurse, it's a responsibility to understand the patient, explore the patient's concern. If he says so that I don't want to take particular test, let's say the patient is a doctor has suggested for some investigation for, let's say, MRI, and the patient has refused to undergo that. Now, your responsibility as a nurse, that you should find out that why. Again, you can't be judgmental, say why you want to go, but say, "Okay, well, I understand your concern that you don't want to go for an MRI. May I know what is bothering you, why you don't want to go for that." Now, ask the question why, but in a very polite way and in a very other way. You can't be a straightforward say, "No, the doctor has prescribed you MRI and it is very important, you must go." Now, this is not a right way to answer it. The right way, first always acknowledge what the patient said. "Okay, well, I understood that you don't want to undergo MRI. Would you mind explaining me that why you don't want to go? What is bothering you?" Now, this is the right way. First acknowledge, don't be judgmental, and then ask in a polite way that what is the concern, what is bothering you, and then try to give Explain to the patient with certain examples. If the patient has such a fear or something, you have to give reassurance. Maybe he's claustrophobic. You need to be need to be reassured that okay, don't worry, I will be there, or anything like that. So that all, how do you explore, how do you answer, all this are very important here. Now coming to the third one, which is providing structure. It means, how do you move further the interview, like two persons are talking to each other, and how do you move to the next step? How logically the questions that you ask, how do you explain, what are the techniques that you are trying to use while explaining the things to the patient? Make sure you always use a easy way, a simple way to understand, a layman way, no medical abbreviations, and try to talk in a simple steps like firstly, secondly, and finally. Never talk in a big lines, don't use the long sentences, because that will confuse the patient. Use a small and precise way of sentence, so that the patient can understand in one line that okay, why it is the why he should undergo MRI. Yeah. So these points, when you change from one topic to the another topic, is very clearly you should indicate to the person like, okay, well, now I'm going to talk about the diet. All right. And then secondly, I would like to highlight the importance of daily exercise. Now, whenever you talk about this, always highlight it first that I'm going to talk about this, and that. Now, that gives a clarity to the patient. Now, fourth point is information gathering. I'm just going through a superficial of it. I'm not going in detail because I will take this separate session on each one of these module, so that you can understand it in a better way. Okay, so information gathering. How do you ask the question to the patient? How you should ask, like you cannot ask closed-ended questions, you should always follow open-ended. Now when I say open-ended and closed-ended, it means open-ended is when patient has to talk more, why, when, describe, all that. And closed-ended when the answer is in yes or no. So if I'll just say the patient, let's say I have to ask the patient his smoking history, and I'll say, do you smoke? Now, do you smoke? Of course, the answer will be yes or no. He'll say yes, or he'll say no. Now, this is called a closed-ended question. We should never ask this kind of questions. It has to be open-ended. Now, what is open-ended? Open-ended is, um, what about your smoking history? Or what about your smoking habit? Now, when I say what about your smoking habit, now patient will explain me everything. If he smokes, how many cigarettes he takes, how long he have been smoking, he has been smoking. So all these things comes under that. He will respond it. So always ask open-ended question, no closed-ended. Secondly, never mix two questions together. Patient will be confused. Either he will answer one or will forget the other. So remember, ask each question one by one. Another third point which you need to keep in mind, never interrupt the patient. When patient is talking to you, saying you something, you must listen patiently. Never interrupt the patient. Never say, oh yes, I noted that, I have listened that. No, don't stop the patient. And then clarify. If patient has any doubt or anything which is not clear to him, you must clarify. And at the end, you need to summarize all the information which you have collected from the patient. Let's say you asked a lot of questions like any past medical history, any allergic history, any regular medications, all these questions. Then at the end, you need to repeat all this. Okay, so what I understood from you that you're a smoker for 25 years, you take 8 to 10 cigarettes in a day, you don't drink, you don't get time for exercises, then you always eat outside. Is that right? Say yes. Now always confirm. Is that correct information? He'll say yes. So then ask, do you want to add some more information into this? That means you are encouraging the patient to talk more. Yeah, so that is called, this is the point. The based on that, if you use all these steps, then definitely you'll get again 30 score. Now, the last is information giving. How do you give the information to the patient? There is also a way to do that. Um, Before you explain anything to the patient, always check the patient's knowledge. Maybe he is already aware. If I'm going to suggest something about how to stop smoking, how to quit smoking, then if I'm suggesting, divert your mind, go to friends and keep yourself busy with your family. Now, that means I should ask to the patient, maybe he has already done this practice before, which didn't work. So before you explain anything to the patient, always first ask that, do you have an idea about this? If you say, yes, I know that this is that, then you say, oh, I must appreciate you for that. Let me just add on more information into this. Then you talk firstly, secondly, and finally. There will be always three advices in your role play. You have to pick and choose that three advices and talk in a points. Like firstly this, secondly this, and finally this. That you need to organize within the task. Now, when you explain something to the patient, you must stop after that. Like I'm giving a pause. When I say one line, I stop after that. Why? Because I want you guys to understand. And I'm also giving you an opportunity to ask me any questions in between if you have anything in mind. So this is a very important step that when you speak to the patient, you explain to the patient that, let's say I said, oh, you must include green leafy veggies and seasonal fruits in your daily diet, along with you must take plenty of water. Now I'll give a pause here for some seconds and then I'll ask again. This is a pause. Why I'm giving a pause? Because I want the patient to retain that information. And then after giving a pause for like 1, 2, 3, give a few seconds and then you can ask, is that clear? Do you understand? Ask these kind of things to confirm the patient has understood what you told. Now, again, encourage the patient to share thoughts, and let's ask the patient at the end, when you have explained firstly, secondly, and finally, then after giving advice, always encourage the patient to ask you more questions. How you can do that? You can ask that, do you have any further questions from me, or do you have any further concerns for me? He'll say yes or no. If he says no, okay, then wish him a speedy recovery or give a leaflet or anything. Or if patient is admitted, just say that, okay, that please press the buzzer for any further assistance. So you can use this kind of steps. So this was a very superficial way of information which I've given you. However, during the class, we will go in each of these topic in detail and we will discuss it one by one in detail. All right. So this is a very minor information. Okay, now just a quick questions for you guys. It says formal versus informal. We always use a formal language in the exam since this is a professional exam. So now when I talk about a polite way of asking something, when I say, can I take your pen? Can I? When we use can I consider it's not that polite way to ask. It seems like you're saying that, okay, I'm taking your pen. You're not asking a permission actually. When you say, can I take, it is not a permission. You're informing that I'm going to take this. But when we say that, could you please give me your pen? Now, this is the more appropriate way to ask. So always use a passive language and a formal language in your questions when you ask to the patient, like, would you mind if I'll ask you some questions? Could you please describe about your past medical history? Now, this is how we use more passive and formal language. Now, a quick question for you guys. There's a patient who's saying, oh, I'm really worried and scared about my surgery tomorrow and getting negative thoughts. Okay, so patient is worried about the surgery. So what should be, as a nurse, what should be your appropriate response? Number one, you'll say, yes, that's right, it will be fine. Second, I know it must be scary, but trust me, it's a small and simple procedure. Third, We do this all the time. It is easy and routine surgery. So tell me, what would be the appropriate response for this? Anyone? Okay. All right. So B is the appropriate answer. You'll say that I know, acknowledge what the patient say. I also can say, I know, I can understand. It will be difficult, but trust me. Now you're ensuring the patient. So acknowledging what the patient said and then ensuring. This is the appropriate response to this question. Now, quiz 2. A patient is saying, I know doctor has advised me to take Panadol after every 6 hours, but I don't have a pain now. I won't take it. Now, you know, the patient is talking to you and telling that I know the doctor has told me to take paracetamol, but I don't want to take because I don't have a pain. Now, what would be your appropriate response as a nurse? Number one, it is your wish. I will inform the doctor. No, I don't think we ever say like that. Okay, look at the second option. Your doctor has advised, so you must take. Yeah, this is something common. We say, no, your doctor has told me to give you, so you must take it. Now, third, trust me, this is a safe drug and will take care of pain along with inflammation. Now, this is the right way. Then you can say that, well, this is one of the best drug to control not only the pain, it also prevent inflammation. So I would suggest you to take this medication in order to avoid any further complications. Now, of course, remember your appropriate response should have a logic, right? Quiz 3. When a patient says, I'm diabetic and worried about my future, I won't be able to eat and live normal life. Now, as per patient, he is worried about future and he thinks that because of diabetic, he will not have a normal life. So as a nurse, I should say that don't worry, you can lead normal life. I think don't worry is just an empathization. There's no logic that why. Yes, you're right, life is difficult now. Oh, I cannot be that much straightforward. Well, you can live and eat normally, just modify your lifestyle with positivity. Now, this is the more appropriate response. That you can have a better life, same life, and you just have to do some changes in your lifestyle. Never say the patient to stop something. He always get anxious and will get opposed that why should I do this and that. I don't want to quit this habit. You have to say that, always say, never say quit it immediately. Say you have to do some changes. Nobody can do in just one go, but we can reduce, like in case of cigarettes, instead of saying that no, you should quit the smoking, because it's not easy if a person is taking 10 cigarettes in a day. So instead of compelling the patient to quit the smoking, I would rather say that, well, don't worry, I can understand that it is not easy to quit as you are a smoker for last 25 years, but don't worry, I'll help you. Now we can work on this and we will quit one cigarette in a day. We'll make a plan like that. So when you talk to the patient, always say some, when especially in these kind of things, that don't worry, your lifestyle will not be changed. There will be some minor changes into that which is easy for you to do. You have to give a confidence to the patient that yes, he or she can do it. Okay, so this is the right way of giving a positive and appropriate answers or responses to the patient. I hope you guys might have got a little bit idea. So anyway, just for more detailed session, you guys can join me online. We provide online coaching and we give daily sessions Monday to Friday, and Saturday is always a mock test. So for more detail, obviously you can contact me on this email ID on a You can also, if you will type on a Google just Lean Core Academy, you'll get all the details and my numbers. You can contact me for this. We provide individual, group, and even a crash courses, whatever kind of, or which are quite flexible with the timings. So we can work upon that. For more details, you can always contact me on this number. I hope you might have got some bit idea of this. And if you have more information, you can more concerns, you can contact to me.